Good afternoon, everyone. Welcome to Nashville General Hospital's Wellness Wednesday Facebook Live program, highlighting family medicine. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. Joining us today is Dr. Monica Davis, a family medicine provider at Nashville Healthcare Center, Midtown location.
Dr. Davis is board certified by the American Board of Family Medicine. She received her medical degree from Meharry Medical College and completed her residency in family medicine at Memorial Hospital of Burlington County in Mount Laurel, New Jersey. Everyone, please welcome Dr. Davis.
Hi, thank you, Kaylin and Kathy. I'm Dr. Monica Davis, and I have been in practice for 23 years. And I'm here to tell you just a little bit about what I do as a family practitioner and kind of compare what I do versus an internal medicine physician. So one thing we say about family medicine is we have a saying, from the womb to the tomb. And basically that means we see patients of all ages. In the past, a lot of family practitioners used to do obstetrics as well. That's not so common anymore. There's still some family practitioners in rural areas that do that. I do not do that in my practice. Also, some family practitioners do inpatient care, but a lot of us do strictly outpatient, and that is what my practice is about. We do outpatient care. There's three aspects to the type of care that family practitioners provide. A big one is preventive care. So that includes things like physicals and pap smears. We do blood work. We can order mammograms, preventive testing that is to catch things early so that we can diagnose and treat illnesses before they become a problem. Another thing that we do, we treat chronic illnesses, things like diabetes, high blood pressure, even things like depression. We can treat a lot of chronic illnesses, and not all of our patients need to see specialists for their chronic illness. We do problem visits, which are like sick visits. If you have symptoms, you have abdominal pain, a cold, you can certainly see us for that. And we can also do procedures. So if you cut your finger, if you have an infection of your skin, we can do little minor office procedures to treat those things as well. A lot of people don't realize that we can do all of these things. And for sick visits, they might end up going to an urgent care or emergency room. But that's not always necessary. We can handle a lot of things in our office. So, don't get me wrong, if you have an emergency, if you're having chest pain, you think you might be having a heart attack, please go to the emergency room. But for other minor things, we can evaluate, do an exam, testing, try to diagnose it. We can treat it. Some of the time, if we feel like you need to see a specialist, we can certainly refer you to one. But that's a conversation that, of course, we would have. Let's see. And I was just going to mention that if you do want to see your family doctor for a sick visit, but you're not sure which way to go, if you think you might need to go to an emergency room or urgent care, you can always call your family practitioner's office and talk to their nurse or talk to the doctor themselves and determine which way you should go for that. So another thing about the scope of practice, and it kind of depends on where that doctor lives. So doctors that are in more urban areas and cities, and I'm sorry, not doctors, family practitioners. We're talking about family practitioners. For more urban areas, there's a lot of OBGYNs available. There's a lot of pediatricians available. So most family practitioners see patients starting from the age of 6 on, because the pediatricians are so widely available. If a family practitioner lives in a more rural area where there's not OBGYNs and there's not pediatricians, they tend to be the ones who will see children, young children, and will do obstetrics and deliver babies. So, family practitioners, it's a whole range of things that we can do. And we can keep you hopefully out of the ER, out of the hospital, and do a lot of things in-house. So I am taking new patients. So anytime you're welcome to call my office and schedule an appointment with myself or my partner, Dr. Tara Long. So do you have any questions?
Thank you very much, Dr. Davis, for sharing this very informative presentation on family medicine and just giving everyone a quick and brief overview of family medicine and what you do here for Nashville Healthcare Center and Nashville General Hospital. And I would like to invite everyone, if you do have any questions for Dr. Davis, please feel free to ask in our chat. I will be monitoring the live chat as we continue on with our Q&A portion. So I'm going to kick it over to Kathy.
What is the biggest difference between an internal medicine provider and a family medicine provider? So if I have a child that's been going to a pediatrician, and they turn 18, can they go to you, or should they go to internal medicine, or should they have been going to you all along?
Okay. So internal medicine physicians, they do most of their training taking care of patients in the hospital. Family practitioners, they do a little of both, but they really lean more towards the outpatient type of care. So internal medicine physicians take care of patients in general, older patients who have a lot more chronic illnesses. And don't get me wrong, family practitioners can take care of a lot of chronic illnesses as well. But internal medicine doctors, they also can specialize. So, they go into cardiology, endocrinology, gastroenterology, they start off in internal medicine and then branch off into those specialties. So they are used to seeing sicker patients and more specialty care patients. So in general, young patients, patients who don't have a lot of chronic illnesses, they're very well served by going to a family practitioner. And sometimes, I will, as my patients age and develop more chronic illnesses, I might suggest to them, you might be better off seeing an internal medicine physician. But we really can handle a lot of chronic illnesses for patients.
So your team would work, you would actually refer patients to those specialists.
To the specialists, yes. And some patients, choose to see an internal medicine doctor on their own. I mean, there is a lot of overlap between what they can do and what we can do. Mm-hmm. But for the most part, if you end up in the hospital with, some sort of problem like, heart attack, heart disease, it's going to be an internal medicine doctor that's going to be taking care of you in the hospital.
So someone like me, part of the sandwich generation, I have children, but then elderly parents, you would be able to care for the whole family.
Yes, absolutely. And that was the whole premise behind family medicine to begin with, is that It's very helpful to get to know patients and their families, because you can take better care of them if you know more about, their family dynamics, their family medical history, and all of those things. So yes, they can all see us together.
And there was a question that was submitted in the chat. How are family medicine providers trained since they have to know so many different things?
That is a good question. So we do, of course, go through college. We do 4 years medical school and 3 years of residency. In the beginning of residency, we spend most of our time in the hospital, seeing patients that are admitted to the hospital. So we see the sicker patients, the more chronic illnesses early on in our training. And then second year, it's kind of a mixture of both. We do inpatient and outpatient. And then by the time you're in your third year, it's more outpatient than inpatient. And that's the beauty of being a family doctor is, there are some family doctors who want to do hospital medicine, and that's fine. They can do that if they want to, but the training gives us the option to do both. And the trend, in the last, 10, 15 years has been more so for family practitioners to do more of the outpatient, where internal medicine does more of the inpatient.
Thank you, Dr. Davis. And then we had a question that was submitted previously for this live. So the question is, can my baby see a family doctor instead of a pediatrician? And then also as a follow-up, do you deliver babies?
I do not deliver babies. I did when I was a resident, but I haven't done so since. But yes, we do see kids typically from the age of 6 and up. One reason for that is that we do not have the childhood vaccines in our office. So they would not be able to get those important vaccines with us. So they're better served seeing a pediatrician for the younger children. And there's so many pediatricians around in the area that they're widely available. Have I seen, children as, young babies? Absolutely. But for the most part, they're better served if they're 6 and younger, if they're younger than 6 to see a pediatrician instead.
Thank you.
How often should someone see their family medicine provider? And then what screenings do you recommend for people depending on their age, like in your 20s and your 30s, and then so forth, like me in my 50s?
Well, in general, you should see your family practitioner once a year, just for physicals and preventive care. As far as preventive treatments, it depends on the age of the person. So obviously, mammograms we start doing at age 40, colonoscopies age 50, but there are some exceptions to those. So again, it's preventive testing. You always want to have that discussion with your doctor, and they can recommend specifically what testing you might need and at what age you would need it. And I'm sorry, what was your other question?
Just the different screenings for various ages.
Oh, okay. Yeah. Oh, and you did say, you did ask me about how often, and younger patients could get away with, maybe come to see their doctor every couple of years. But in general, once somebody hits 30, I recommend that they come every year. And also younger children should come every year for their well-child checkups as well.
And do you do sports physicals, or worker physicals, and that's not the right term, sorry. But I know some jobs you have to have physicals in order to be in those.
Yeah, absolutely. We do sports physicals, and we see, some work comp exams. Yeah, and I do a lot of physicals for teachers. They always have to have, or daycare workers, they always have to have a physical every year. So they have a form that has to be filled out. So we do those physicals as well.
And I am still, just for everyone who's watching on a digital landscape, I am still monitoring our Facebook Live chat for any questions that may come in while Dr. Davis is on. So please feel free to comment in the Facebook chat below. Let me see.
I'm just curious, was there any certain thing while you were in medical school that led you to family medicine versus any of the other specialties?
My story is probably similar to a lot of people in that in the beginning, I kind of bounced all over the place as to, I want to do this specialty, I want to do that specialty. But I finally decided that, what, I like a little of everything, and family practice allows you to do that. So it was the perfect fit for me. And you never know what's going to walk in the door. So never a dull moment.
That sounds like our job, Kaylin.
Basically. I would say, well, I think we're coming close to time, Dr. Davis, but I did want to ask you a question regarding, so is there a particular, I know with family medicine, you tend to see a vast array of patients with different, different ailments or different reasons that your patients may come to you, because family medicine can be all encompassing. But are there any things that you've seen or any advice that you would give to anyone that's viewing this in order to help themselves live a healthier and a better life, that, when they come to you, they may get a better report the next time they come visit you than the time before?
The most common thing that I see that people are not doing is, well, two things. Exercise. There's a lot of people, including myself, that work on a computer, a lot during the day, and or maybe they're exhausted at the end of their work day, they're too tired to exercise. Just get up and walk, walk 30 minutes a day for, at least 4 or 5 days a week. Get enough to get that heart rate up. And it's really good for your heart, really good for your just overall health. And also, the Southern diet is not the best. So, more fruits and vegetables, less fried foods. That's a big one for us here in the South.
Well, thank you. Thank you. I think we should end it there. I think that's a great place to end it. Thank you very, very much, Dr. Davis, for all your advice and for the wonderful information you shared today. Kathy and I, we really appreciate it. And I'm sure all of our viewers today appreciate it as well. But if you have any additional questions for Dr. Davis, please continue to comment below, or feel free to send the Nashville General Hospital Facebook page a private message, and we'll be sure to send it over to her. But then also, to schedule an appointment with Dr. Davis or Dr. Long, please call Nashville Healthcare Center Midtown at 615-341-4419. Again, that number is 615-341-4419.
Thank you, Dr. Davis.
Thank
And
you.
it sounds like it can be summed up in eat better and move more.
Yes, ma'am.
Have a great
Have a
day,
great day.
everyone.
Bye-bye.